drag queen, or perhaps you're gay. Is there a point to all these fancy clothes? With all these buckles from your head down to your toes? It's very simple, but I'm just another girl. It's not so easy, but I'm giving it a whirl. Is there something that you're trying to prove? With all the makeup and the way you move, are you looking for some sympathy? No, I'm trying to be the best girl I can be. It's very simple, but I'm just another girl. It's not so easy, but I'm giving it a whirl. Like my martinis dry, cosmos I won't deny. Smoke those long cigarettes. Thank God I'm not dead yet. Done all these crazy things, short of a wedding ring. Just another
Good evening, and thanks for joining us. I'm Callista Solon, and you're watching nlcTrans. Tonight, I'm here with my usual co-host and dear friend, Tara Alexander, and we have a very special guest tonight, who is a doctor, a surgeon, and somebody that has, one of my doctors, in fact, somebody that's done some really wonderful things for me, and we're going to introduce him in just a moment, but there was one thing I wanted to talk about first. While I've got everybody's attention, I wanted to talk a little bit, just very quickly, about Kenny Jorgensen. We, a good friend of ours and one of our group's members, Kenny Jorgensen, passed away recently and last week, and I just wanted to say that we were very sorry about that, and we will miss him very much. And our thoughts and prayers are with Kenny's family, and especially with Jocelyn, who is one of our members also, and was Kenny's fiance. And anyway, Kenny was a very special guy, and we will miss him. Also, very quickly, we have the Walk for the Homeless this Saturday the 25th in New London. Registration is 9 to 10 a.m. at the Daytime Hospitality Center, 19 J Street, New London. And on the very same day, they're having a big deal, big tent event auction at the Restore, which is 400 New London Road, Salem. For those of you that have not been there, it's right next to Salem Country Gardens, really cool place, and that's benefits the Habitat for Humanity, and they're having that auction 10 a.m. to 6 p.m. I just wanted to tell everybody about that. Anyway, so I wanted to introduce our guest. This is Dr. Robert Leonard, who is a specialist in hair restoration, hair transplantation, and something that obviously I was one of your patients, and I'm gonna talk at length, obviously, about that, because it was something that was really incredible and very, very important for me, and it's one of those things you can't possibly, especially for a woman, you can't possibly understand how important it is to have hair. Hair is so integral to femininity, and it's so tied to your sense of self and your self-image that having any kind of hair loss is really devastating. And you specialize in fixing that.
I do. I've been in hair restoration surgery now for the last 23 years. I started training in 1986 with one of the largest hair transplant practices in the country. And I was just very fortunate to be where I was when I was there. And I met Dr. C.P. Chambers, and he took me under his wing, and it's history from there. It's a field that has evolved dramatically over the last 20 years. And thankfully dramatically, because most people, when they hear about hair transplants, they think about what? Plugs.
Plugs, right.
And that's a bad word in my office. Plugs was a technique where very large pieces of skin with hair were transplanted from the back in sort of like a cornrow appearance.
Right. Right,
And,
I have seen that.
Yeah, well, that's the difference about transplants then and now, because transplants in those days were very evident. They were very visible, and people were happy to have hair, but it didn't look as good at all as compared to what we do today, which is virtually undetectable.
Yeah. Well, I'm a, obviously I'm a patient. For me, and we look at Tara here, who transitioned a bit younger than I, and has this wonderful, thick, beautiful head of hair, and we're all very jealous.
My parents.
We're all very jealous of that. But I transitioned a bit later in life, and I had the effects of long-term exposure to testosterone. I had a little bit of male pattern recession in the hairline, and that was one of those things that was. It was a huge deal for me because I didn't know what I was going to do about that. I wasn't looking to be wearing a wig for the rest of my life, and I was very self-conscious about that. And obviously I came to see you, and you did the procedure on me, which was a very cool procedure. It was very easy for me. I just kind of sat there and watched movies while everybody did their thing.
We did all the work, if I remember.
Yeah, which was good. I liked it that way. But it's a pretty involved thing, and obviously I'm going to let you tell us about the procedure. But it was something that it did wonders for me. It was one of those things you don't realize until after it's all over. And now I have a full head of hair. You can't possibly know what a huge difference that made for me.
Well, I know even when I transitioned at work, getting my hair colored and cut by Lily was a huge confidence boost, and that was just redoing what I already had.
Yeah.
So actually being able to look in the mirror and see a full head of hair has got to be an enormous confidence.
Yeah, it's huge. It was huge for me, and as a woman, it was just. I used to wear barrettes and stuff to keep my hair. I was afraid to go out in the wind because I had a little bit of my hairline. I was lucky. When I went off testosterone on estrogen, a lot of my hair came back, but not all of it. And so this was a really huge thing for me.
And I think it's one of the things that tends to not be talked about very much when you talk about transsexuals transitioning. Male to female, when they start taking the testosterone, their body can get hairy and they can start to experience hairline recession.
Yeah.
But male to female, especially later in life, there's a lot of people you may hear talk about facial hair removal or hair removal, but nobody really talks about adjusting it in the other way, when the hair on your head, when the hair that you want to have a lot of isn't cooperating.
Yeah, and it is so essential to femininity, that a head of hair. It really is. It's bad enough for guys, and guys obviously suffer from this. You have great hair.
I have a little recession.
But guys, they can sort of. Guys have this procedure done too, but they can sort of get away with it. For a woman, it's devastating. And I was amazed at how many women actually have hair loss.
It's amazing. Hair loss is devastating for women. It's a horrific situation because in our society, it's normal to see men lose their hair. They may not like it one darn bit, but it's normal, it's accepted. Right. Yes. But for a woman to lose her hair, it's horrific because the comments patients tells me, it's like they'll be in public and say, geez, are you going bald? Or do you have cancer? Or the most cruel things that people say to women about hair loss.
Especially
and you're
kids.
right.